So we've talked a lot about the gut microbiome. The new microbiome that everybody's talking about, maybe not new for you and I, is the gum microbiome. So we're talking about gingivalis, the bacteria that causes gingipains. It's a destructive enzyme, which leads down a path of a high percentage of people getting Alzheimer's. Last night, they talked about gingivitis increasing dramatically the incidence of AFib. So how do you talk about the gum to gut axis?
One of the screens we teach people to do when they do a new patient evaluation is to look at their gums, make sure they don't have any indication of gingivitis. Pseudomonas gingivalis being one of the most severe destructive ones that's been linked to many things. We published a study in the Journal of Alzheimer's Disease linking it to different target proteins, the beta amyloid plaques that develop in Alzheimer's disease a few years ago. First big clue you have gingivalis is like you have really bad breath. That's a red flag. And as a clinician, if you're hearing a patient's history, if you're doing an exam and they just have really bad breath, you really want to look at the gums, make sure they're not tethered, they're not swollen, they're not inflamed. Dental hygiene is really critical. People have to have their plaque removed, like regularly cleaned, because plaque, is where these bacteria store. And once that vicious cascade sets in, these bacteria can hide in different cavities in the mouth, different notches in the gum line, and it can be very, very, very hard to eliminate. This is just a reminder for people listening to go get a dental exam, usually get your teeth cleaned. And especially as people get older, they're much, much more prone to gingivitis, periodontal disease. It's a big player. These bacteria produce antibodies, and these antibodies can't cross-react. These antibodies produced against Pseudomonas gingivalis, for example, can bind to different target proteins of beta amyloid and then create that process in nerves causing this plaque development and formation. And I'm sure when they're seeing this association between AFib or different cardiovascular disease, I'm sure some of these bacteria are binding to cholinergic receptors in the heart and causing some dysfunction in those nerve plexus as well.